there's increasingly more tools and solutions for clinical patching strategies that can be safely applied to endpoint management. And Texas Health Resources and Pete, they've been longtime clients of First Health, and Pete's very progressive and is on a long journey to establishing solid risk reduction processes and tools within his environment. He's been quite successful. So Pete has, at this point, a mature team. His workload continues to increase like any HTM department we encounter. He came to First Health in search of a more efficient way to patch endpoints, IoMT endpoints. And we landed on one in particular that worked well for him, a WSUS solution, for instance, and implemented and managed by First Health. And with that, I think it's a good time to pass to Pete to share a little bit about the challenges that you see, real life challenges in tackling these patching goals, the expectations applied to your team, and how that solution is working for you.
Yeah, thank you, Olin. You can all hear me okay?
Yes.
Yeah, so yes, what we wanted to do first, we started this journey probably around 2017. And it really started when we got the WannaCry. As we all probably remember that, we were scrambling to use thumb drives and make sure we had the patches, contact vendors, and if it was the vendor was going to do it, if we were going to do it, and so forth. So it kind of caused some chaos. And, I was thinking, and my team was thinking, there's got to be a better way to manage how we patch medical devices, because we know this isn't going to be the only time this happens, right? So we started looking at, okay, first we've got to get our inventory correct. We need to know what's on the network. Not only do we need to know what's on the network, but we need to understand what level operating systems we have, and so forth. So we went out and bought a tool that helps us be able to see IoT devices on the network. So that was the first thing that we wanted to do. Included in that also is obviously the vulnerabilities that come with that. And I'll talk about that later, but we definitely needed to see what was on the network for IoT. And not only did it do medical devices, but it did everything else. So it was really nice. We could see facility cameras and so forth, but I'm going to specialize on the medical devices because that's my expertise. So we installed that, and then we decided to integrate that with our CMMS system to have a bidirectional feed. So what we could do is we could be able to pull in the operating system, the IP address, host names, whatever data point from an IT perspective you wanted to add to that asset, we could do that. And then the bidirectional side is we sent the asset tag out to match with in our IoT. I don't know what else to call it. I guess I'll just say it, Medigate for us, because I don't know what else to call it. We use Medigate. So we sent the asset number to Medigate so that we could identify devices a lot quicker with our asset number, because that's how we identify it in our CMMS system. So we started pulling all that together, and then we realized we still needed the trying to think of what it's called, MDS2s, right? We all need the MSDs2s. So we finally got that on all our devices too, because of the Medigate we were using that came with the MDS2s, which, I'm sure you're all familiar, so I don't have to go over what an MDS2 is, but we have those all for our network devices as well. So we were looking pretty good there. We could see what was on the network. We were still doing a manual process using USB and, loading the software on that, going to the medical device. And I didn't like that either, because if we got an infection on that USB, we're just going to spread that around to each medical device. So I was not keen on doing that. So we looked for a another way to help our techs, make it easy for them, because it is a slightly different skill set. So we partnered with Health Advisory, and we came up with a solution called the WSUS solution. And basically, what that allows us to do is it allows us to contact the vendor, because we need to know if the vendor has if it's going to be done by the vendor in house, or if there's going to be an exception to that. So we have it all marked in our CMMS system. If the vendor supports it, if it's in house, it means we support it internally. We will update it, or if there's an exception, that there's no patching on that. So it's really important in our CMMS system that you get all this information, especially who's going to patch it. And then we decided to do that on our printed PMs. When our PMs come out each month in HTM, we have 30 days to basically complete the PM. So what we're now doing is we're looking at our PM list and looking at all those network devices and seeing if they need to be patched. What we have also is a team that's our staffing supported right now by First Health, to be able to validate and load those patches onto the WSUS server, allowing my team just basically to point the device to the WSUS and load the approved patches. And it can take anywhere. We did a lot of testing on non-critical devices. It can take anywhere from 20 to 30 minutes to an hour, depending on when the last time this device was updated. So as you can imagine, it's pretty much our first time adding all these patches. So, the first go around is probably going to take the longest to patch those devices. So when our PMs print out now, we know we have to call the vendor or to do the patching. If it's a vendor related patch, then we call the vendor to make sure that they come in within that month to do the updates to that device. Most of those are lab devices. We coordinate that with the lab directors and staffing. They'll come in, they'll update the latest, greatest. And what we do is we take that paperwork and we actually attach it to the asset so they can see that, or we run reports, we can see that device was patched. We also have to make sure we do our due diligence in documenting within the Medigate system to show that vulnerability has been remediated, and thus showing our risk level as it drops as we patch. And again, this is great because it's being proactive. So we're not waiting for another fire drill, if you will, to, send my team, stop everything they're doing to go patch everything. So now we're being proactive. Is that going to stop us doing a fire drill? Probably not. We'll probably have some that will come in and we got to immediately go remediate those, like an internal blue or whatever that may be. But at least now what we can do is we can put it on the WSUS server, and it allows my team, the techs, the boots on the ground, just to point the device and not have to worry about calling the vendor, making sure it's approved, and then putting on a thumb drive. They can just point the device and load the updates very quickly and very easily. That's kind of what we're doing now. Some of the lessons learned, we had to look at our onboarding process and our offboarding process. We wanted to make sure that the entities and the system knew that we had 10 working days to deliver these devices. Our goal is to update them with the latest, greatest software before they actually get into use. So we had to rewrite some of our policies and procedures on how we do that, and making sure that bidirectional feed is working between our CMMS system and Medigate. So there's a whole process we've got to do for onboarding. And then offboarding, as we all know, we just got to make sure that we do our due diligence to remove the hard drives and whatever PHIs on those devices. So we had to take a look at that policy. The other lessons learned on our side was staffing. One thing that I could probably done a better job in is understanding the workload that this takes on the back end to make it easy for my team on the front end, the boots on the ground. There's a lot of calling the vendor, validating, the patches, making sure that those are on the WSUS. And I think too, sometimes the vendors, unfortunately, you have to make a few calls to get to the right person that knows what you're talking about. Unfortunately, that still happens. And so that can take some time. It could take you a week or so to get that patch and put it on the WSUS server. And so we have all that work not on our techs, but on the back side of it. And it makes it a lot easier for my techs. Like I said, they can just go to the device, point it, and run the WSUS and update. Also, another thing about the WSUS is it also has a reporting tool in there, so we know what patches were applied to those medical devices, and it can range from anywhere from 1 to like, I don't know, 20 to 100 patches that we put on there. So, and sometimes it takes a while too, because one patch might have to go on before the other one, or vice versa, and so sometimes you have to reboot it and start again. So, I'm appreciative of First Health helping us out with augmenting our staffing for the backside of that. I'm lucky enough to, we work very closely with IT. Ron Marion's very, very forward looking. I've had the privilege to work with him for quite a few years, and he's really helped us be able to lead us to kind of where we are now with our patch management system. So it's important, that was said earlier, to have a great relationship with your IT staff. So other things that we're kind of looking for in the future is SBOMs, which is all the software that comes with the medical device. So we're looking to start collecting the SBOMs as well as the MDS2s. And so that's in the future. And that's our journey.